Mr. Speaker, I rise today to share with you stories of real people and the urgent need for health care reform in this country. One of my constituents from Boulder, Colorado, Maria Thomas Rutzik, wrote to me the other day and shared her story, which really struck close to home for me and impressed in me the need for Congress to act now and pass health care reform. Maria has always had a fine medical record and decent dental coverage as a state university employee, and her husband also had what they thought was good coverage through the architectural firm that he worked. They even had the option of covering their children in her plan or his plan or both. However, her husband, Maria's husband, is a type 1 diabetic, and he incurs on average between $5,000 and $6,000 a year in expenses to keep his diabetes under control. It goes to simple routine needs: insulin and insulin supplies, test strips, monitor upkeep, other medications, regular lab work, and doctor's checks. And as they near retirement age, the planning around their needs becomes even more critical. Maria often thinks about those with diabetes who don't have health care coverage, who can't control their blood sugar levels or related issues. I'm reminded of the story of a young woman at the school that I served as superintendent of before serving in Congress, the New America School. Her name is Kimberly. She, like Maria's husband, suffered from diabetes. Unlike Maria's husband, Kimberly had no health care insurance. At 19 years old, she was no longer part of the children's health care insurance, and because she didn't have access to health care insurance, she had no access to ongoing treatment, insulin monitoring, and injections that could have made her condition manageable. So it got to the point where she had kidney failure and was admitted to the hospital and had to be given emergency dialysis. Now, the cost of that emergency dialysis treatment, subsidized by the rest of the taxpayers because Kimberly didn't have health care insurance, would have paid for 2 years of treating and monitoring Kimberly's condition, beyond the human element of having to force Kimberly to be sick enough to stay home from school and miss work to get emergency dialysis. Beyond the human element of it, how can it make sense to spend in one day what we could have spent in 2 years to provide a manageable outcome for her diabetes? Maria concludes that their story is not particularly special. It just underscores the importance for health care reform and the need to pass it now. Thank you, Mr. Speaker.